Manual Handling Risk Assessment Case Study 13. Patient non-weight bearing in plaster. In this case study, a patient wearing long leg plaster is moved from bed to wheelchair. The patient is lying flat on the bed and has a full leg of plaster. A carer arrives pushing a wheelchair and positions it beside the bed, and then assists the patient in using crutches to move from the bed to stand upright on the floor. The patient then hobbles with the crutches a few steps and is guided by the carer into the wheelchair. In a case like this, a risk assessment of the task should be carried out in order to develop a better way of working which reduces or eliminates the risk of injury. This assessment should include looking at how the job is carried out, collecting information, for example, the task, load, and the patient's needs and mobility, identifying risk factors with the job, and making changes to improve the job. Let's now look at the risk factors and problems encountered with this job. The transfer to the wheelchair may involve the sudden movement of the patient. During the movement, the patient is unwieldy and difficult to grasp. There is also the potential of other risk factors. The individual weight could be outside the guidelines. Both the carer and patient could be bending and twisting the trunk, and the physical effort of the task could be too strenuous. Once a risk assessment has been carried out, a new system of work can be adopted to reduce manual handling, as demonstrated in the following sequence. The carer positions the wheelchair closer to the bed than in the previous scenario. The bed is lowered automatically by the carer, and a banana board is put into position under the patient to allow them to slide from the bed onto the wheelchair. This has eliminated the need for the patient to stand upright on the floor, and in doing so has reduced the risk of injury. The risk of injury to the carer has also been reduced, as the amount of manual handling involved has been decreased significantly. Manual handling: assess to avoid, reduce, or reorganize.